I'm here with patient Test Freeman. We are changing a PICC dressing change or central line dressing change on the patient. So first thing we do is introduce ourselves and let the patient know what we're doing. Today, Mr. Freeman, I'm changing your PICC dressing change. And if you'll look at this dressing example, the dressing's clean, dry, and intact, but there has been an IV left below that was more than likely inserted before the PICC line. This needs to be discontinued since you already have a central line in this arm. It can cause complications or increased risk of collapse. If you look in this example of a PICC dressing, the dressing is intact, but it is not clean and dry. Look at the bio patch. The bio patch is saturated, compromised. This dressing, it needs to be changed with a new bio patch. It does not have a stat lock, doesn't require a stat lock, but you may want to place one as you notice that it has been pulled out a few centimeters to maybe stabilize the line better. Also, there is blood in the line. This line needs to be aspirated and flushed. The caps have blood in the caps. The caps need to be changed. So this example shows several things wrong of why it needs to be changed. So I've already introduced myself to the patient. I have already told the patient what I'm going to do. When I came in, I washed my hands and applied my gloves. A lot of times the tape measure will come in your kit. If not, go ahead and get you one. The first thing you'd like to do is measure the circumference of the patient's arm. The reason we do this is make sure there's no increased swelling. If there is, you'd want to notify the physician. And remember, when measuring the arm circumference, you measure 10 centimeters from the AC up the arm, and then at the 10 centimeter mark around the arm to get your arm circumference. And then we'd get a measurement of 33. You would put this in your documentation. A lot of times what we'll do is we'll go ahead and just so we don't forget what our measurement was. We already have all of our supplies we brought in before. The next step would be you'd want to change all your caps depending on how many lines you have. This is a triple lumen PICC, so I have 3 caps. I'm only going to change one now just for time purposes. As an example, you don't want to contaminate your cap. You want to keep it in the package. First thing you do is remove the cap and scrub directly to the hub for at least 15 to 20 seconds. As a reminder, when you're drawing blood from a PICC, you never draw directly from the cap. You always remove the cap, clean, draw your blood, clean again, and apply a new cap. Once your new cap is on, you will draw back, look for blood return in your PICC line, and then flush with pulsatile flush until the full 10 is given. At this point, I'll take my old gloves off, re-wash my hands, and apply my gloves. The next step is we want to remove the old dressing. I brought 2 ChloraPreps. You only need 1. Sometimes it's nice to bring extra supplies in case you need them while you're here. If you do not have a bedside table available, use your bed. I've already applied the mask to the patient. This kit does come with mask. You will put a mask on the patient so you do not contaminate the area. Here's my tape measure. I've already measured my arm. You do not want to contaminate your dressing. Stay on the borders of your dressing kit. All kits are different. In this kit, everything is one area. I brought an extra stat lock that we're going to change. To drop this on your sterile field. Next step, we want to remove the old dressing. On this dressing, on the contour, as you're lifting from the back, there's a perforation here that will tear away. You grab from the bottom and pull away from yourself and it will tear smoothly. You will activate your ChloraPrep, holding the line down and using to wipe the skin as you go. This will make it easier on the patient since these are very sticky. This is mainly just not so you do not contaminate the area. Once you've pulled away, wipe any excess blood or anything, that dried blood around the borders. If you notice this bile patch is slightly turned in, I do not want to contaminate. I can use my ChloraPrep to push and pull away. At this point, I need to put on my sterile gloves. I'll take my old gloves off, re-wash my hands with sanitizer, and apply my sterile gloves. Activate my ChloraPrep. I want to clean at the PICC site, insertion site. You want to clean this site very well with an up and down motion. Clean any excess blood or materials. Once I get to my ChloraPrep, my stat lock, I want to get it really wet to help take it off. Once this is ready and I've cleaned all around, tear from the wings first. Sometimes under this underneath portion is very difficult to get off. You might want to use your ChloraPrep to kind of push off. This is the point where you can lift your PICC and peel away. Clean where the wings were, clean the PICC, cleaning down. Once the entire area has been cleaned, allow to dry. This will take at least 30 seconds. Make sure it is completely dry. Once it is completely dry, you can apply your new stat lock. You pull these tabs away from you. Let the wings go flat down on the skin to secure the PICC. You might now apply your bio patch. The slit goes towards and all the way around your line. There is also skin protectant. You may use this to go around the borders. A lot of times this protects people that have frail skin, your elderly population that's prone to skin tears. This dressing has a window. Apply your window over the bio patch and insertion site so it may be assessed. Press straight down and smooth out. Your dressing will go linear with the line in the same direction. Smooth out the bottom part of your dressing. Your 3 ports will come out this slit. This is the bottom part of the dressing, the securement piece of the dressing, so it does not allow it to, when it pulls, to pull the dressing up. This slips in this notch. Pull the wings to secure and make sure it is completely stuck and it's clean, dry, and intact. You will also want to date and initial your dressing so the next nurse will know when the dressing has been changed. Okay, we are now going to document on tests, Freeman. We're going to go into our interventions. We have IV line assessment. I'm going to insert this occurrence since this hasn't been documented yet. This is a new PICC. When you go into your documentation, you will notice that there's IV location, site, size, type, and length. This can only be documented under the first assessment. The VATS team normally will not document here the first time. So the nurse following the insertion will document in these areas, and all following assessments will not be allowed to be documented here. So if you're the first nurse to do your assessment, you will document here as insertion. All other nurses will document this as a sterile dressing change. This is on the left arm, so always put your location. This is the upper arm. This is a triple lumen. This is a 5 French. Today's date is when it was inserted. The central line type is very important. This will always be sent over to the vascular access team for reports. This is also how we catalog collapse reviews and things. So it's very important that you put what kind of line this is. This is a triple lumen. Remember, there's 3 lumens to this PICC. If it was a tunneled catheter, it'd be more than likely up in the chest area, or a temporary dialysis would be a subclavian or IJ. Sometimes these are femoral. So your location and your top of line is very important. As you move down, this patient was asymptomatic, it was intact, all lines were patent. If this is also where you document if you saw any leaking, bruising, anything like that. This line was inserted by the vascular team. We're not going to chart that. We just did the dressing change. We noted there was blood return. It flushed easily. If it was sluggish, this is where you chart sluggish. This is also the moment, if it's sluggish or you don't see great blood return, you want to make sure you notify the vascular team or the physician so you can get calf flow to declot your PICC. We flushed this line. We did a sterile dressing change. This is also a good moment to change all your tubing for your line. You should label all your lines. If this is a new PICC, this has to be done before you connect any of your new tubing to it. You cannot put an old tubing to a new central PICC or any kind of line. We labeled it, we changed our caps, we applied our bio patch. Also, if you had to declot this line, this is your calf flow area. This line is clean, dry, and intact now. If you were discontinuing your PICC, this is the area that you would chart if you used Vaseline gauze and things like that. We did use a securement device. It's a stat lock, securement dressing. In central lines, this is where you'd say there was suture material. We dated our line. This is very important that you know when it was dated, because in 7 days this line needs to be changed, or if there's issues with the dressing. We measured the arm circumference. It was 33 centimeters. External, there was 1 centimeter. And then it's also important we know why this patient has a PICC. Is it for TPN? Is it for long-term antibiotics? Are they getting Levophed, viscid medications? This is where we need to document this. Is it for chemotherapy? This patient might be also a difficult access. These are important things. How did the patient tolerate it? This patient tolerated it very well, no complaints. And then in your IVA comments, anything you would like to say. You could say that 1 lumen didn't work well, VATS team notified, called physician, line had been pulled back, chest x-ray ordered. Things like that can be documented here. You will then save, and it has now been documented for your central